my name is Julian. Today we are administering blood. I have the physician's order open here, and our patient entry Jerry, VIN number 261-824-375. And so we're going to take a look at the order. So it's for packed red blood cells, and it's 1 unit over 2 hours. Okay, so that we have that, we're going to take a look for consent. So we have the right patient here, entry Jerry, VIN number 261-824-375. And it is signed by our patient and it's current, so we are able to transfuse the blood. Okay, knowing that, I would send a requisition down, which I have, and I got my record of transfusion and my blood bag and blood tag sent out here. So now at this point I would grab a second nurse so she can do my check. He or she can do my check with me. So we're gonna compare first the record of transfusion with the demographics. So with the name, entry Jerry, A-T-R-I-Q-U-E, J-E-R-R-Y, and then the VIN number is 261-824-375. So that's the right patient. And now we're going to be comparing the record of transfusion with the blood tag here. Alright, so we have our right patient, entry Jerry, A-T-R-I-Q-U-E, J-E-R-R-Y, VIN number is 261-824-375, and now we want to take a look at our patient's blood group here. So it's AB positive, the donation blood group is AB positive, so that is compatible. And we're going to take a look at the donation number, and so it's 051089900-445 and Y in a box. Okay. So now that that is finished and our nurse has verified that, we can now compare the blood bag with the blood tag. So we have our product. So it's red blood cells, you can see here, and red blood cells. We also want to take a look at the donor's blood group. So it's AB positive and AB positive. It's compatible still. And we're going to take a look at the donation number. So it's C 051008900-445, Y in the box. And she verified that it was also correct there. Now we can take a look for expiration of this. And I see that it's not expired, the cross match is not expired, there's no leakage, no discoloration, no clotting, so it looks good to use. Right, so I'm going to just bring in my supplies with me. So we're going to use a 250 normal saline bag to prime. We're going to use a blood tubing. We're going to have the blood. And I brought gloves, flushes, alcohol swabs. And then I also have pre-calculated my rates. So the first 15 minutes we're going to start slow, 50 cc's, and then we're going to raise the rate after that 15 minutes. Okay. So I'm going to do my hand hygiene prior to entering the room. We're going to do a safety check of the room. Patient non-distress, bed is lowered, environment looks safe to enter, and I'll just introduce myself. Hi Jerry, my name is Julie and I'm your student nurse today, and we're just going to be transfusing blood. Since I have my nurse here, I'm just going to do my checks. So I'm going to be checking the armband with the blood tag with my nurse here. So I'm just going to check your wristband here, okay Jerry? So we have entry Jerry, so Jerry, J-E-R-Y, and entry, A-T-R-I-Q-E. VIN number is 261-824-375. And Jerry, can you just spell out your first and last name for me? Perfect. And your date of birth? Wonderful. Okay. So Jerry, I'm just going to be doing some education. So we've noticed that your hemoglobin was low. So the physician has ordered red blood cells transfusion, and that should help bring up your hemoglobin. With this transfusion, we kind of want to watch out for any reactions that may happen, such as shortness of breath, hives, or dizziness. And if you feel just weird or off, let us know. The call will be there, and you can let us know. So I've taken your baseline vital signs, but throughout the transfusion, I'm going to be continuing to take out your vital signs. So 15 minutes I'll stay with you, and after that 15 minutes I'll take your vital signs. During the transfusion, every hour I'll take your vital signs, and at the end, and then 1 hour after your transfusion. And I know you signed the consent, but is it okay if we still do this? Perfect. Okay. So I've noted that the emergency line is here, and it's primed with normal saline, so that looks good. And I'm just going to prime my line here.
So now I'm going to be starting my feeding.
So I'm going to make sure this is clamped first. And I'm going to be priming with the 250 normal saline. So we're going to maintain sterility. Spike. And then we're going to spike the pipe.
Okay. Making sure not to make it complicated or anything. I'll make sure that it's clamped.
And now we're going to submerge this valve with the normal saline, so when the blood goes through and we prime the blood, that it doesn't hemolyze.
And then I'll prime my tubing. I'll make sure to maintain sterility. So I'll open this up. Yep, coming.
I'm just going to squeeze so we can get the
Okay, yes, L1.
here.
They need a reset.
Okay, so now I see that it's primed. So now I'm going to prime it. Start hanging this. Now I'm going to put it in the cup. So I'm going to be comparing my mask, my med level, and my.
So now that we see that it's submerged, we want to make sure there's no bubbles in there.
Then I'll go to the
Clamp it off. And now we can prime the blood, but since we're handling bodily fluids, I have gloves to use.
For pricing, this is the right patient. Insulin 2 milligrams, insulin 5 milligrams. This is 100 units, so I say 100 units. Diluent is 101, so I say 101 ml. Concentration is 0.99 minutes per ml, 0.99.
Now I'm going to prime
The dose is going to be, so I see IV continuous 2 units per hour, so I'm going to put 2. I see 2 units per hour IV continuous, and the time is going to be. So I primed it, put it up. I'm going to call my second nurse to check. So my second nurse
I'm going to be very careful to maintain sterility.
and we're going to spike TKBO, so my second nurse they can independently check that this is the right thing. So now I'm going to put my medication.
And now we're just going to prime the blood here.
Hold it.
And we're going to try to prime the blood so it gets closest to the end.
So now everything is programmed, coordinates have been called. Now I'm going to connect it to my patient.
You can see it's moving down there.
I'm going to clear the lines. I'm going to stop the line for 30 seconds so it can start completing. And now I'm going to okay.
And there you go. We can see a little bit of pink at the end there. Okay. And now we can connect it to the pump. So I'm going to click primary. I'm going to label this line here. And I'm going to label the line. And we're going to go down to red blood cells, select. And now we can change the volume here. So the volume, we're going to take a look at the bag. And it's 358, 358. And we're going to, so for the first 15 minutes, we want to have a slow rate just to monitor for any reaction. So we're going to do that as 50 mils per hour. And that looks good. We're going to confirm the primary. And we're going to open this up. move this down here. Okay, now that it's in, we can now connect it to the patient. We're gonna check for the patency. So we're gonna clean his saline lock here. So we're gonna clean for 30 seconds. Then we're gonna allow 15 seconds to dry. And we're going to flush it. So now that it's flushed, we can connect the line here. So the patient is now connected. We're gonna check for clamps. And this is clamps, so we're gonna unclamp it. We also want to take a look at these clamps. And this, for the normal saline, we should clamp that one, and for the blood, we're gonna leave that unclamped. And we can start the. So it's going for 50 mils per hour. We're gonna take a look for 3 drops here, okay? So that's 1, 2. And 3 drops. Perfect. Okay, Jerry, so like what I've said before, I'm going to be here for 15 minutes. We're going to monitor for any signs of reactions that you may have. And if you have any, make sure you ring your call bell. And like I said, I'll be taking your vital signs throughout. We've talked about that before. And yeah. So I'm going to do a safety check of the room, lower the bed, make sure the call bell is there. And then after that 15 minutes, we're going to be changing the rates to 197 mils per hour. And then I'm going to go out, document, sign with my nurse to post it. Yeah, that's it.